Cancer prevention. Eat more purple foods for cancer prevention and a healthier gut and heart. Polyphenols, also known as phenolics, are phytochemicals, natural plant chemicals with powerful antioxidant properties. There are over 8,000 identified polyphenols found in foods such as tea, wine, chocolates, fruits and vegetables. Antioxidants, which in addition to polyphenols include carotenoids and amyl sulfides, help protect your cells from free radical damage, thereby controlling general aging and disease potential. If your body does not get adequate protection, free radicals can cause cellular damage and dysfunction, raising your risk for chronic diseases such as heart disease, cancer and Alzheimer's disease, just to name a few. Polyphenols can be broken down into 4 general categories: flavonoids, stilbenes, lignans and phenolic acids, with additional subgroupings, based on the number of phenol rings they contain, and on the basis of structural elements that bind these rings to one another. As a general rule, foods contain complex mixtures of polyphenols, with higher levels found in the outer layers of the plants, such as the skin. Polyphenols give fruits, berries and vegetables their vibrant colors and contribute to the bitterness, astringency, flavor, aroma and oxidative stability of the food. The role of polyphenols in human health. In the human body, polyphenols have diverse biological functions and properties, including fighting cancer cells, and inhibiting angiogenesis, the growth of blood vessels that feed a tumor, fighting free radicals and reducing inflammation, protecting your skin against ultraviolet radiation, protecting against dementia and Alzheimer's disease, promoting brain health, reducing the appearance of aging, improving bone metabolism, reducing your risk for osteoporosis, modulating your gut microbiome. Polyphenols have a prebiotic effect, nourishing beneficial bacteria, promoting normal blood pressure and protecting your cardiovascular system, thereby lowering your risk for cardiovascular disease. Flavonoid polyphenols help to reduce the clumping of platelets in your blood and improve the function of your cells that line your arteries and veins, supporting normal blood sugar levels, stabilizing fat metabolism and reducing insulin resistance, thereby lowering your risk for type 2 diabetes. As noted in a 2010 scientific review in the journal Nutrients, research in recent years strongly supports a role for polyphenols in the prevention of degenerative diseases, particularly cancers, cardiovascular diseases and neurodegenerative diseases. Recent studies have revealed that many of these diseases are related to oxidative stress from reactive oxygen and nitrogen species. Phytochemicals, especially polyphenols, are the predominant contributor to the total antioxidant activities of fruits. Rather than vitamin C, polyphenols have been found to be strong antioxidants that can neutralize free radicals by donating an electron or hydrogen atom. Polyphenols complement and add to the functions of antioxidant vitamins and enzymes as a defense against oxidative stress caused by excess reactive oxygen species, ROS. Although most of the evidence of the antioxidant activity of polyphenols is based on in vitro studies, increasing evidence indicates they may act in ways beyond the antioxidant functions in vivo. Modulation of cell signaling pathways by polyphenols may help significantly to explain the mechanisms of the actions of polyphenol-rich diets. How polyphenols protect your heart health. The research supporting polyphenols in the prevention and treatment of cardiovascular disease is particularly well documented. For example, higher intakes of fruit-based flavonoids, specifically anthocyanin-rich foods, fruits and berries with a blue, red or dark purple hue, and those high in flavonols, particularly citrus fruits like grapefruit, lemons and oranges, has been found to lower the risk of non-fatal myocardial infarction and ischemic stroke in men. Keep in mind that to reap these benefits, you need to eat the whole fruit, not fruit juice, which is simply too high in fructose for optimal health. Excessive fructose is associated with insulin resistance and associated health problems, including diabetes and heart disease. Here's a sampling of other studies showing how polyphenols helps protect your heart health. A systematic review of 14 studies found intake of 6 classes of flavonoids, flavonols, anthocyanins, proanthocyanidins, flavones, flavanones and flavontriols, can significantly decrease your risk of heart disease. Researchers have long puzzled over how flavonoids help prevent heart disease, but a study published last year suggests it has to do with the fact that metabolism of flavonoids enhances their bioactivity in endothelial cells, which form the lining of your blood vessels. Flavonoids also help to reduce the clumping of platelets in your blood. Platelet clumping is one potential precursor in heart attacks and angina. As antioxidants, polyphenols scavenge free radicals and reduce inflammation in your body. Polyphenols also inhibit vascular endothelial growth factor, VEGF, which causes complications with atherosclerotic plaques in the arteries, a factor in cardiovascular disease. Purple potatoes may lower risk for colon cancer. The study in question investigated the effects of purple potatoes in pigs fed a high-calorie diet, which has been linked to an increased risk of colon cancer. Pigs were fed one of 3 diets for 13 weeks. High-calorie diet. High-calorie diet supplemented with raw or baked purple potatoes, rich in phenolic acids and anthocyanins, antioxidant compounds shown to have anti-cancer properties. Standard control diet. Compared to the control diet, the high-calorie diet was, as expected, found to increase the level of interleukin-6, IL-6, a pro-inflammatory protein known to promote cancer in the colon. The potato-supplemented diet, on the other hand, lowered IL-6 nearly 6-fold compared to the control group. Other research confirms the anti-cancer benefits of polyphenols, especially for colon cancer. A study published last year found polyphenols helped inhibit the proliferation of colon cancer cells and induce cancer cell apoptosis, programmed cell death, through oxidant-mediated mechanisms. Health benefits of mulberry. Mulberries are also rich in polyphenols and other antioxidants. As far back as the Roman Empire, mulberries were used to treat diseases of the mouth, throat and lungs. Native Americans discovered them to have a laxative effect and used them to treat dysentery. Nutritionally, mulberries contain an assortment of high-powered nutrients, such as vitamins A, B complex, C, E and K, each bringing their own constituents for health. They also contain iron, potassium and magnesium. One of the most beneficial resources in mulberries is resveratrol, said to promote heart health and overall vitality, according to the Institute for Traditional Medicine. Traditionally, mulberry fruit has been used as a medicinal agent to nourish the yin and blood, benefit the kidneys and treat weakness, fatigue, anemia and premature graying of hair. It is also used to treat urinary incontinence, tinnitus, dizziness and constipation in the elderly and the anemic. Make polyphenol-rich foods part of your daily diet. It is generally recognized that polyphenols are powerful nutrients that protect your health by fighting against free radicals and preventing damage from oxidation. Free radicals are highly reactive molecules that steal electrons from important tissues like your DNA, proteins and cell membranes. The loss of an electron, in turn, oxidizes these cells, which makes them unstable and easily breakable. As this free radical damage continues, cells can no longer perform properly, tissues begin to degrade and disease sets in. Free radicals are a natural byproduct of breathing. Antioxidants mop up the excess and leave the rest to fulfill their other functions. This fine balancing act can be easily tipped to the point of either too much or too little. A diet rich in organic fruits, vegetables and nuts will typically supply you with the antioxidants needed to walk this fine line. One reason why a varied diet of real food works better than simply taking antioxidant supplements is the fact that the isolated antioxidant may not be the exact one your body needs at that moment. Fruits and veggies, on the other hand, contain a wide array of plant compounds, not just antioxidants such as polyphenols, creating a synergistic effect where the total benefit is far greater than the sum of its parts. What happens to your kidneys when you ingest baking soda? Sodium bicarbonate, commonly known as baking soda, is a chemical compound typically found in the form of a fine powder. It has salty and alkaline taste and a wide range of uses, from shampoo, deodorant, cleaning agent, and toothpaste to medical practices. This fine powder had been used by ancient Egyptians to create a paint for their hieroglyphics, while the real factory developing baking soda was established in 1846 by 2 eminent bakers from New York. Medical uses. Baking soda raises pH levels. Paste made with baking soda and water treats allergic reactions from ivy poison. Baking soda helps remove splinters. Solution made with baking soda and water creates a potent antacid. Baking soda inhibits the progression of kidney failure. Being produced by the pancreas in order to protect the kidneys, sodium bicarbonate is critical for our health. When these organs lack bicarbonate production, acid accumulates in our bodies, requiring a treatment to remove this acid buildup. How to repair your kidneys naturally using baking soda, and why you should. On the first day, you should dissolve half a teaspoon of baking soda under the tongue. The following day, mix half a teaspoon of baking soda and half a teaspoon of salt into 1.5 liter of water. Drink this solution daily over the course of 2 to 3 days. According to Dr. Thomas P. Kennedy, substituting a sodium bicarbonate solution for saline infusion prior to administration of radiocontrast material seems to reduce the incidence of nephropathy. Nearly 3 million people suffer from chronic kidney disease in UK alone. While only an estimate, nearly 38,000 of these patients need renal replacement therapy, which costs $45,165, £30,000, annually. The first controlled test was done at the Whitechapel Hospital in Royal London, showing that baking soda can drastically slow down the effects of kidney disease. As stated by the team leader, a professor of renal medicine named Magda Yaqub. It's amazing. This is the first randomizing controlled study of its kind. A simple remedy like sodium bicarbonate, baking soda, when used appropriately, can be very effective. The study involved 134 participants with advanced kidney disease, and a randomly picked group was given a sodium bicarbonate tablet on a daily basis for a year. This group noted a 2/3 slower decline of health when compared to the untreated group, and they were less likely to need dialysis. Only 9% of the treated group had a rapid progression compared to 45% of the untreated group who experienced rapid progression. According to Professor Magda Yaqub, this study shows baking soda can be useful for people with kidney failure. That is, as long as the dose is regulated and under supervision. What happens is the inflammation of kidney is prevented by baking soda because a chemical reaction takes place limiting ammonia production in the kidney. This cheap and simple strategy also improves patients' nutritional well-being and has the potential to improve quality of life, and of course a clinical outcome that can remove the need for dialysis. Baking soda is not classed as a drug, so this study has never been tried before.